I'm TAEGANNE Galger. I'm a fifth-year Human Kinetics major at the University of Regina, and I did my fieldwork placement at Scott Anderson and Associates Physiotherapy. Scott Anderson and Associates Physiotherapy is a physiotherapy clinic that primarily aids in the rehabilitation of clients who've sustained injuries through work-related incidences or motor vehicular accidents. The clinic also treats private clients as well as athletes of various sports. New patients undergo a thorough evaluation, including extensive medical history and a neurological assessment. Rehabilitation programs are then customized to individuals' needs, ranging from inferential therapy, exercise prescription, transcutaneous electrical nerve stimulation, to manual therapy. Over the course of my placement, I had the opportunity to work with Jessica, a client who was diagnosed with complex regional pain syndrome, also referred to as CRPS. Being that CRPS is such a rare disease, I immediately took interest in her case and decided to use CRPS as my topic for my special project. My original special project idea was to create a series of full body exercise routines for Jessica to encourage her to increase her strength, range of motion, and function within her affected leg. I wanted to be able to create an exercise program for Jessica that allowed her to be active without risking CRPS flare-ups, as well as I wanted to create low-intensity exercise routines that she could perform when she was having flare-ups. My initial timeline on my special project was using February to conduct research on CRPS and the physiotherapy techniques currently being used to treat it. For the month of March, I was planning on collecting background information with Jessica, determining what was causing her flare-ups and making a few adjustments to her current exercise routine to see if the modifications would decrease her symptoms. Then using April to work with my supervisor to create a customized exercise program for Jessica, and then hopefully having time to trial it. However, due to the COVID-19 pandemic and Jessica's CRPS flare-ups, I was unable to continue this project and I was forced to adjust my special project idea from the exercise program to an informational brochure. My special project was to create a brochure on complex regional pain syndrome to be left in the clinic for clients, students, and employees to be able to reference when needed. After performing extensive research, I created a brochure on complex regional pain syndrome. As you can see in front of you, my brochure consists of multiple sections regarding CRPS. My overall goal of the CRPS brochure was to give a simplified overview on the syndrome, describing what CRPS was, how it was caused, the symptoms, how it was diagnosed, and what CRPS flare-ups were, as well as the various treatment options currently being used. The purpose of the brochure was to educate Jessica, future CRPS clients, and any students or employees working with the CRPS clients in the clinic. The objectives of the brochure was to create a resource that effectively educated people on CRPS and the many treatment options available. I wanted to provide Jessica and future CRPS clients with education on techniques to use to manage their pain, as well as I wanted to help her understand the syndrome more, as information on CRPS is quite limited. It was also my hope that this brochure would enable employees or students to easily educate themselves on CRPS and hopefully continue the work that I initiated with Jessica. Overall, I was sad I was unable to complete the exercise program for Jessica, but I was extremely happy with how the brochure came out, and I believe that it was a successful adjustment, and I'm happy with the end result. My supervisor was also happy with the end result, especially since I was leaving behind a brochure to be used in clinic to assist with the application of treatment with CRPS clients. Most importantly, Jessica was happy with the brochure. It reassured her that she would be in good hands after I left, and she found that the brochure provided her with new education about managing her pain. This project was extremely valuable as it allowed me to meet some of my learning objectives, as well as I had the opportunity to gain knowledge in the area of pain. From working with Jessica, I learned how careful and empathetic you must be when working with certain people and their conditions. In addition, I was able to accomplish my learning objectives involving learning more about CRPS and the physiotherapy used to treat this syndrome, as well as I was able to learn how to modify exercises when working with specific populations. Although I was not able to apply all the information that I learned from creating this brochure, it was extremely beneficial and it has given me the confidence to work with clients with complex issues in the future.